because it's a rehabilitation setting and you want them to become more independent. So falls are going to happen, but we want to prevent them as much as possible and prevent the severe injuries. Nurses is there 24 hours a day, 7 days a week. And we are also the first person that the patients meet. We are the first ones to do the assessment. And because of that, we're very, very important in the team. We'd like to get you set up so that you can go home. And we're going to help you to do that. And we want to make sure we inform the patients that they are safe, and make sure they know where the call bell is, and instructing the patients that if you need to go to the bathroom, I want you to call the staff so that you can get some help. When you are trying to get up, it will sound like an alarm like this. Hear that? We want to make sure there are no cords in the way, no tables in the way. We move the patient closer to the nursing station so we can have a closer eye on the patient. And also sometimes we put mats on the floor to prevent severe injuries if they do get out of the bed. Or sometimes we have a very low bed, so they're also close to the floor as well. The whole family should be involved so they can again reinforce what we have already instructed.
Dad, it sounds like you're in safe hands and we're going to get you home soon.
Well, I feel that way. I feel with a combination of the expert nurses, the physio people, real experts, the OT people, real experts, I can't miss.
Now we want to make sure that your lower back really is loosened up, okay? So we're going to bring one knee up to the chest and back. So let's start with the right knee.
The whole team is very important. A nurse can't do it on their own. If we do some strategies to decrease falls, it's important that everybody on the unit is aware of those risk factors. We have identified him as being a high risk of falls. His diagnosis is right lateral stroke, and he has a left-sided weakness. There's all kinds of things that you can look at, and then you can get feedback from all the team members. For example, a dietitian can be involved. Maybe they're dehydrated, maybe they're not getting enough nutrition, and that's why they're very frail. I think that now, since I've been the champion for the fall prevention, I can very easily go in and assess the patient on the first day, and I can get very quickly a picture if they're going to be high risk or low risk. And I think I got the team a little bit more on board now. Since we got the RNAO practice guidelines, falls have definitely decreased, and has helped the staff to do the necessary strategies to prevent the falls.